Today's NCLEX question. A nurse administers ceftriaxone 250 milligrams intramuscularly into the ventral gluteal muscle of an adult client. At which angle will the nurse insert the needle? 45 degrees, 60 degrees, 15 degrees, or 90 degrees? What should we be paying attention to? First, an intramuscular injection is most commonly injected into the ventral gluteal site. The desired needle length is a 1 to 1.5 inch needle with a 22 to 25 gauge, although a longer or shorter needle may be needed depending on the patient's weight. Second, intramuscular injections are administered at a 90-degree angle. The answer is 90 degrees. IM injections deposit medication into the muscle, where it is absorbed by blood vessels within that muscle. The rate of absorption is slower than by the IV route, but faster than by the subcutaneous route. IM injections should be administered at a 90-degree angle using a quick motion. If this content was helpful, like this video and subscribe to the channel. Share with someone that might find this useful. Happy studying!